HESI Nursing Exam Questions. Question 1. A client is 1 day postoperative following a left. Which of the following actions should the nurse take? Continue to monitor the client as this is an expected finding. Add more water to the suction control chamber of the drainage system. Verify that the suction regulator is on and check the tubing for leaks. Milk the chest tube and dislodge any clots in the tubing that are occluding it. C. Verify that the suction regulator is on and check the tubing for leaks. Correct answer. The correct answer is C. Verify that the suction regulator is on and check the tubing for leaks. Rationale: 1. Lack of bubbling in the suction control chamber indicates suction may not be working. 2. Checking the suction regulator ensures it is on and at the correct level for proper drainage. 3. Checking tubing for leaks ensures the system is intact and functioning properly. 4. This intervention addresses the potential issue of inadequate suction, which can affect the client's postoperative recovery. Summary: Option A. Continuing to monitor is not appropriate as lack of bubbling suggests an issue with suction. Option B. Adding more water to the suction control chamber is unnecessary and does not address the root cause. Option D. Milking the chest tube is not recommended as it can cause trauma and dislodging clots may lead to complications. Question 2. A client has a newly inserted chest drainage system with a water seal. Which of the following actions should be taken? Clamp the tube when the client is ambulating. Keep the collection device below the level of the client's chest. Carefully coil the tubes to prevent kinking. Position the client flat to avoid leaks in the tubing. B. Keep the collection device below the level of the client's chest. Correct answer. The correct answer is B. Keep the collection device below the level of the client's chest. This is important to ensure proper drainage and prevent backflow or air from entering the pleural space. Placing the collection device below the chest allows gravity to assist in drainage. Clamping the tube while ambulating, choice A, can lead to increased pressure in the chest, risking complications. Coiling the tubes, choice C, may cause kinks, obstructing drainage. Positioning the client flat, choice D, can lead to leaks in the tubing due to elevated pressure. Question 3. When prioritizing client care after receiving change of shift report, which of the following clients should the nurse plan to see first? A client who is scheduled for an abdominal X-ray and is awaiting transport. A client who has a prescription for discharge. A client who received oral pain medication 30 minutes ago. A client who told an assistive personnel he is short of breath. D. A client who told an assistive personnel he is short of breath. Correct answer. The correct answer is D because a client who is experiencing shortness of breath may be in a critical condition requiring immediate intervention to prevent respiratory distress or failure. This is a high priority issue that needs prompt assessment and intervention to ensure the client's safety. A. A client awaiting transport for an abdominal X-ray is not in an immediate life-threatening situation. B. A client with a prescription for discharge can typically wait as the discharge process can be coordinated by other healthcare team members. C. A client who received oral pain medication 30 minutes ago is not experiencing an urgent or life-threatening situation, as the medication may take time to alleviate pain. Question 4. When preparing a client for transfer to the ICU, the nurse should explain that this catheter is used to monitor which of the following conditions: intracranial pressure, spinal cord perfusion, renal function, hemodynamic status. D. Hemodynamic status. Correct answer. The correct answer is D. Hemodynamic status. A pulmonary artery catheter is used to monitor hemodynamic parameters such as cardiac output, pulmonary artery pressure, and central venous pressure. This helps assess the patient's circulatory status and guide interventions in critically ill patients. Explanation: 1. Pulmonary artery catheter measures cardiac output and helps in assessing the heart's ability to pump blood effectively. 2. It provides information on pulmonary artery pressure, which reflects the pressure in the right side of the heart and pulmonary circulation. 3. Central venous pressure is also monitored, indicating the fluid status and right heart function. Summary: A. Intracranial pressure, incorrect. Pulmonary artery catheter does not monitor intracranial pressure. B. Spinal cord perfusion, incorrect. Pulmonary artery catheter does not monitor spinal cord perfusion. C. Renal function, incorrect. Pulmonary artery catheter does not monitor renal function. Question 5. A healthcare professional wishes to provide client-centered care in all interactions. Which action by the healthcare professional best demonstrates this concept? Assesses for cultural influences affecting healthcare. Ensures that all the client's basic needs are met. Informs the client and family about all upcoming tests. Thoroughly orients the client and family to the room. A. Assesses for cultural influences affecting healthcare, correct answer. The correct answer is A, because assessing for cultural influences affecting healthcare aligns with client-centered care by recognizing the individual's unique beliefs and values. This action promotes respect, understanding, and tailored care. Choice B might address physical needs but not necessarily emotional or cultural aspects. Choice C focuses on information sharing rather than understanding the client's perspective. Choice D, while important, does not directly address individualized care based on cultural factors. Question 6. A client is caring for a postoperative client on the surgical unit. The client's blood pressure was 142/76 mmHg 30 minutes ago and is now 88/50 millimeters Hg. What action by the nurse is best? Call the rapid response team. Document and continue to monitor. Notify the primary care provider. Repeat blood pressure measurement in 15 minutes. A. Call the rapid response team. Correct answer. The correct answer is A. Call the rapid response team. A significant drop in blood pressure from 142/76 mmHg to 88/50 millimeters Hg indicates a potential life-threatening condition like hypovolemic shock. Calling the rapid response team allows for immediate assessment and intervention to stabilize the client. Other choices are incorrect because documenting and monitoring without intervention can lead to deterioration. Notifying the primary care provider may cause delays in critical care, and repeating the blood pressure measurement in 15 minutes may worsen the client's condition if urgent intervention is needed. Question 7. When orienting a new client and family to the inpatient unit, what information should the nurse provide to help the client promote their own safety? Encourage the client and family to be active partners. Instruct the client to monitor hand hygiene in caregivers. Offer the family the opportunity to stay with the client. Advise the client to always wear their armband. A. Encourage the client and family to be active partners. Correct answer. Step 1. Encouraging the client and family to be active partners promotes safety by involving them in care decisions. Step 2. This empowers the client to voice concerns and preferences, enhancing their safety. Step 3. Monitoring hand hygiene, B, is important but doesn't directly involve the client's active participation. Step 4. Offering family to stay, C, is supportive but doesn't directly engage the client in promoting their own safety. Step 5. Advising to wear armband, D, is a procedural measure, not a collaborative safety promoting action. Question 8. When working as a professional nurse, what is the priority for a new nurse working on an inpatient medical surgical unit with a preceptor? Attending to holistic client needs. Ensuring client safety. Avoiding medication errors. Providing client-focused care. B. Ensuring client safety. Correct answer. The correct answer is B. Ensuring client safety. This is the priority for a new nurse working on an inpatient medical surgical unit with a preceptor because safety is the foundation of nursing care. Ensuring client safety involves preventing harm, maintaining a safe environment, and implementing appropriate interventions. Attending to holistic client needs, A, and providing client-focused care, D, are important aspects of nursing practice, but ensuring client safety takes precedence. Avoiding medication errors, C, is crucial for patient safety but is just one aspect of ensuring overall client safety. Question 9. A client is going to be admitted for a scheduled surgical procedure. Which action does the nurse explain is the most important thing the client can do to protect against errors? Bring a list of all medications and their purposes. Keep the doctor's phone number close by. Ensure all providers wash their hands before entering the room. Document the name of each caregiver who enters the room. A. Bring a list of all medications and their purposes. Correct answer. The correct answer is A. Bring a list of all medications and their purposes. This is important as it helps prevent medication errors during the surgical procedure. By having a list of medications and their purposes, the healthcare team can ensure they are administering the correct medications and dosages. This also helps in preventing drug interactions or allergies. Option B, keep the doctor's phone number close by, may be helpful in case of emergencies, but it does not directly address preventing errors during the surgical procedure. Option C, ensure all providers wash their hands before entering the room, is important for infection control but is not specifically related to preventing errors. Option D, document the name of each caregiver who enters the room, is not as critical as having a list of medications, as it does not directly impact the safety and well-being of the client during the surgical procedure. Question 10. Which action best demonstrates respect for autonomy when working with a client? Asks if the client has questions before signing a consent form. Provides the client with accurate information when questioned. Honors the promises made to the client and family. Ensures fair treatment of the client compared to others. A. Asks if the client has questions before signing a consent form. Correct answer. The correct answer is A because asking if the client has questions before signing a consent form shows respect for autonomy by allowing the client to make an informed decision. This action promotes the client's right to self-determination and involvement in the decision-making process. Choice B focuses on providing information when questioned but may not actively involve the client in the decision-making process. Choice C refers to honoring promises and not necessarily respecting autonomy. Choice D relates to fairness but does not directly address autonomy or the client's decision-making ability. Question 11. A student asks the faculty to explain best practices when communicating with a person from the LGBTQ community. What answer by the faculty is most accurate? Avoid embarrassing the individual by asking questions. Don't make assumptions about their health needs. Most LGBTQ individuals do not want to share information. No differences exist in communicating with this group. B. Don't make assumptions about their health needs. Correct answer. The correct answer is B. Don't make assumptions about their health needs. Rationale: 1. LGBTQ individuals have diverse health needs. 2. Making assumptions can lead to inappropriate or inadequate care. 3. By not assuming, you show respect and promote open communication. 4. This approach fosters trust and ensures individualized care. Other choices: A. Avoiding questions can hinder understanding and communication. C. Generalizing that most LGBTQ individuals do not share information is inaccurate. D. Differences exist in the LGBTQ community that should be acknowledged for effective communication. Question 12. During a call to the on-call physician about a client who had a hysterectomy 2 days ago and has unrelieved pain from prescribed narcotic medication, which statement is part of the SPAR format for communication? I suggest ordering a different pain medication. This client has allergies to morphine and codeine. Dr. Smith does not prefer non-steroidal anti-inflammatory meds. The client had a vaginal hysterectomy 2 days ago. B. This client has allergies to morphine and codeine. Correct answer. The correct answer is B because it provides relevant information regarding the client's allergies to morphine and codeine, which is crucial for the physician to know when considering alternative pain medication options. This aligns with the background component of the SPAR format, which includes pertinent patient history. Choice A is incorrect because it jumps to a solution without providing necessary background information. Choice C is irrelevant to the current situation as it does not address the client's pain management issue. Choice D is also incorrect as it only provides historical information about the type of hysterectomy performed, which is not directly related to the client's current pain management concern. Question 13. A nurse working on a cardiac unit delegated taking vital signs to an experienced unlicensed assistive personnel, UAP. 4 hours later, the nurse notes the client's blood pressure is much higher than previous readings and the client's mental status has changed. What action by the nurse would most likely have prevented this negative outcome? Determining if the UAP knew how to take blood pressure. Double-checking the UAP by taking another blood pressure. Providing more appropriate supervision of the UAP. Taking the blood pressure instead of delegating the task. C. Providing more appropriate supervision of the UAP. Correct answer. The correct answer is C. Providing more appropriate supervision of the UAP. By providing adequate supervision, the nurse can ensure that the UAP is performing tasks correctly and can intervene if any issues arise. This would have likely prevented the negative outcome as the nurse could have identified the high blood pressure and changed mental status earlier. A. Determining if the UAP knew how to take blood pressure. While assessing the UAP's competence is important, it does not address the need for ongoing supervision and oversight. B. Double-checking the UAP by taking another blood pressure. This approach does not address the root cause of the issue, which is the lack of appropriate supervision. D. Taking the blood pressure instead of delegating the task. This is not a sustainable solution as delegating tasks to UAPs is a common practice in healthcare settings. Providing appropriate supervision is key to ensuring safe and effective delegation. Question 14. A client is moving to a new state and needs to find a new doctor and hospital there. What advice by the nurse is best? Ask the hospitals there about standard nurse-client ratios. Choose the hospital that has the newest technology. Find a hospital that is accredited by the Joint Commission. Use a facility affiliated with a medical or nursing school. C. Find a hospital that is accredited by the Joint Commission. Correct answer. The correct answer is C. Find a hospital that is accredited by the Joint Commission. This is the best advice because the Joint Commission accreditation ensures that the hospital meets high-quality standards in patient care, safety, and performance. Accreditation indicates the hospital's commitment to providing excellent healthcare services. A. Asking about nurse-client ratios is important for patient safety, but it is not the most critical factor when choosing a hospital. B. Choosing a hospital based solely on technology does not guarantee quality care or safety. D. Using a facility affiliated with a medical or nursing school may provide access to cutting-edge research and expertise, but it does not guarantee overall quality of care provided by the hospital. Question 15. A newly graduated nurse in the hospital states that, since she is so new, she cannot participate in quality improvement projects. What response by the practicing nurse is best? All staff nurses are required to participate in quality improvement projects. Even as a new nurse, you can implement activities designed to improve care. It's easy to identify which indicators should be used to measure quality improvement. You should ask to be assigned to the Research and Quality Committee. B. Even as a new nurse, you can implement activities designed to improve care. Correct answer. The correct answer is B, because even as a new nurse, one can contribute to improving care by implementing activities. This response encourages the new nurse to actively engage in the quality improvement process, fostering a sense of ownership and commitment to enhancing patient outcomes. Choice A is incorrect, as participation in HESI projects is not solely based on tenure. Choice C is incorrect, as identifying indicators requires knowledge and experience. Choice D is incorrect, as it suggests a specific assignment rather than empowering the new nurse to take initiative in improving care. Question 16. How can a nurse manager best improve hand-off communication among the staff? SATA. Attending hand-off rounds to coach and mentor. Conducting audits of staff using a new template. Creating a template of topics to include in the report. Utilizing the SHARE model as a tool for standardizing hand-off reports and other critical communication. D. Utilizing the SHARE model as a tool for standardizing hand-off reports and other critical communication. Correct answer. The correct answer is D, because utilizing the SHARE model helps standardize hand-off reports and communication. 1S stands for situation, providing context. 2H stands for history, outlining relevant information. 3A stands for assessment, sharing assessment findings. 4R stands for recommendation, suggesting actions. 5E stands for explanation, clarifying any questions. This model ensures all necessary information is communicated effectively. A, B, and C are incorrect because attending hand-off rounds, conducting audits, and creating templates may not ensure standardized communication like the SHARE model does. Question 17. When interviewing a client recently diagnosed with lung cancer and having a 60-pack-year smoking history, what is the most important action for the nurse to take? Educate the client about the importance of quitting smoking to halt cancer progression. Encourage the client to disclose both tobacco and marijuana use openly. Maintain a non-judgmental attitude to promote honest communication with the client. Provide realistic information about cancer treatment and prognosis without giving false hope. C. Maintain a non-judgmental attitude to promote honest communication with the client. Correct answer. The correct answer is C, because maintaining a non-judgmental attitude promotes honest communication with the client. This is crucial in building trust and rapport, allowing the client to feel comfortable sharing important information about their health and lifestyle. It lays the foundation for effective care and support. Choice A is not the most important action, as quitting smoking, although important, may not be the immediate priority during the initial interview. Choice B, while valuable, is not as crucial as fostering an open and honest relationship with the client. Choice D, although important, may not be the primary focus during the initial meeting and may not promote the necessary trust between the client and nurse. Question 18. After an open lung biopsy, a nurse assesses a client. Which assessment finding is matched with the correct intervention? Client states he is dizzy. Nurse applies oxygen and pulse oximetry. Client's HR is 55 beats/min. Nurse withholds pain medication. Client has reduced breath sounds. Nurse calls the physician immediately. Client's RR is 18 breath/min. Nurse decreases the oxygen flow rate. C. Client has reduced breath sounds. Nurse calls the physician immediately. Correct answer. The correct answer is C, because reduced breath sounds after an open lung biopsy could indicate a potential complication like pneumothorax. In this situation, it is crucial for the nurse to call the physician immediately for further assessment and intervention. This prompt action can help prevent worsening of the client's condition and ensure timely treatment. Choice A is incorrect because applying oxygen and pulse oximetry is not directly addressing the potential complication of reduced breath sounds. Choice B is incorrect because withholding pain medication based solely on a low heart rate is not appropriate without further assessment. Choice D is incorrect because decreasing oxygen flow rate without proper assessment could be harmful if the client is experiencing respiratory distress. Question 19. A healthcare professional assesses a client's respiratory status. Which information is of highest priority for the healthcare professional to obtain? Average daily fluid intake, neck circumference, height and weight, occupation and hobbies. D. Occupation and hobbies. Correct answer. The correct answer is D. Occupation and hobbies. This information is crucial as certain occupations or hobbies may expose the client to respiratory hazards, influencing their respiratory status. The healthcare professional needs to assess potential respiratory risks in the client's environment. A. Average daily fluid intake is important for overall health but not directly related to respiratory status assessment. B. Neck circumference is more relevant for assessing risk of obstructive sleep apnea rather than overall respiratory status. C. Height and weight are important for assessing overall health and potential respiratory issues like obesity, but not as immediate as assessing respiratory hazards in the client's daily activities. Question 20. When caring for an older adult client with a pulmonary infection, what action should the nurse take first? Encourage the client to increase fluid intake. Assess the client's level of consciousness. Raise the head of the bed to at least 45 degrees. Provide the client with humidified oxygen. B. Assess the client's level of consciousness. Correct answer. The correct answer is B. Assess the client's level of consciousness. This is the priority because changes in consciousness can indicate deteriorating respiratory status or potential respiratory distress. Next steps would depend on the assessment findings. A. Encouraging fluid intake is important but not the first priority. C. Raising the head of the bed helps with breathing but doesn't address potential immediate respiratory distress. D. Providing humidified oxygen may be necessary but assessing consciousness comes first to determine the urgency of oxygen therapy. Question 21. After auscultating a client's breath sounds, the nurse is providing care. Which finding is correctly matched to the nurse's primary intervention? Hollow sounds are heard over the trachea. The nurse increases the oxygen flow rate. Crackles are heard in bases. The nurse encourages the client to cough forcefully. Wheezes are heard in central areas. The nurse administers an inhaled bronchodilator. Vesicular sounds are heard over the periphery. The nurse has the client breathe deeply. C. Wheezes are heard in central areas. The nurse administers an inhaled bronchodilator. Correct answer. Step 1. Wheezes indicate narrowing of the airways, typically seen in conditions like asthma. Step 2. Inhaled bronchodilators help dilate the airways, relieving wheezing and improving breathing. Step 3. Hence, administering an inhaled bronchodilator is the correct intervention for wheezes. Summary. A. Increasing oxygen flow does not directly address the issue of wheezes. B. Encouraging coughing does not address the narrowing of airways seen with wheezes. D. Deep breathing does not specifically target the narrowing of airways associated with wheezes. Question 22. What question should a nurse ask a client who has an anteroposterior AP chest diameter equal to the lateral chest diameter? Are you taking any medications or herbal supplements? Do you have any chronic breathing problems? How often do you perform aerobic exercise? What is your occupation and what are your hobbies? B. Do you have any chronic breathing problems? Correct answer, the correct answer is B. Do you have any chronic breathing problems? This question is relevant because equal AP and lateral chest diameters can indicate a barrel chest, which is often associated with chronic breathing problems like chronic obstructive pulmonary disease, COPD. Chronic breathing problems can lead to this specific chest shape due to increased lung volume. Choice A is incorrect as it does not directly relate to the physical assessment findings. Choice C is incorrect as it focuses on exercise habits rather than the client's current health status. Choice D is incorrect as it does not address the potential underlying health issue indicated by the chest measurements. Question 23. A healthcare professional is assessing a client who is recovering from a lung biopsy. Which assessment finding requires immediate action? Increased temperature, absent breath sounds, productive cough, incisional discomfort. B. Absent breath sounds. Correct answer, the correct answer is B. Absent breath sounds. This finding requires immediate action because it could indicate a pneumothorax, which is a potentially life-threatening complication following a lung biopsy. Absent breath sounds suggest air trapped in the pleural space, leading to lung collapse. Immediate intervention is necessary to prevent respiratory distress. A. Increased temperature is concerning but may indicate infection, which would require monitoring and possibly treatment, but it is not as urgent as addressing a potential pneumothorax. C. Productive cough is common post-lung biopsy and may be managed symptomatically. It does not typically require immediate action. D. Incisional discomfort is expected after a biopsy and can be managed with pain medication. It does not indicate a critical issue requiring immediate intervention. Question 24. Prior to a thoracentesis, what intervention should the nurse complete? Measure oxygen saturation before and after the procedure. Verify that the client has given informed consent. Explain the procedure briefly to the client and their family. Ensure informed consent has been obtained from the client. D. Ensure informed consent has been obtained from the client. Correct answer, the correct answer is D because ensuring informed consent is crucial before any invasive procedure to protect the client's autonomy and rights. This involves confirming the client's understanding of the procedure, risks, benefits, and alternatives. Option B is correct as it directly relates to the ethical and legal aspect of the procedure. Option A is incorrect as it focuses solely on monitoring oxygen saturation, which is important but not the priority before thoracentesis. Option C is incorrect as simply explaining the procedure does not ensure the client's understanding or consent. Question 25. A patient is assessing a client who has just been admitted to the emergency department. The client is having difficulty breathing and is using accessory muscles. What action by the nurse is best? Administer oxygen at 2 liters per minute via duct nasal cannula. Assess the client's vital signs including oxygen saturation. Notify the rapid response team immediately. Place the client in a high Fowler's position. D. Place the client in a high Fowler's position. Correct answer, the correct answer is D. Place the client in a high Fowler's position. Placing the client in a high Fowler's position helps improve lung expansion and oxygenation by maximizing chest expansion. This position facilitates better breathing mechanics and can alleviate respiratory distress. Choice A is incorrect because administering oxygen via nasal cannula should be done after positioning the client properly. Choice B is important but assessing vital signs alone may not provide immediate relief to the client's breathing difficulty. Choice C, notifying the rapid response team, is not the best immediate action as positioning the client correctly should be the priority before seeking additional help.